It's Wellness Wednesday, and October is Breast Cancer Awareness Month. And during this sponsored segment, we're talking with Dr. Sasha Spenceley, a general surgeon at Memorial Healthcare Surgical Associates, who's here to discuss high-risk screening and the benefits of having a mammogram before the age of 40. Good morning, doctor.
Good morning.
Thanks so much for being here.
Thanks for having me.
Now let's get right into it. Now, you hear the term high-risk cancer. What exactly does that mean?
Yeah, so high risk in terms of breast cancer, we're all kind of very familiar with general screening guidelines where patients or women in their 40s will get a mammogram eventually around that time. But there is a very important distinction in terms of high risks. There are actually two different screening categories, one for average risk women and one for high risk. Average risk is the mammogram at 40. Their lifetime risk is generally between 8 to 12% of breast cancer, but high risk are patients who have a lifetime risk over 20%, or certain risk factors that would mean higher or more frequent screening, more screening at a younger age.
Okay, now let's talk about that. Some of those factors that could put someone at a higher risk of breast cancer at a young age. Can you tell us what those are?
Yeah, so there are certain factors, the biggest one being a family history, and it's not just a family history of breast cancer. You can have a family history of uterine, ovarian, prostate, pancreatic, or colorectal cancer can all suggest a genetic predisposition to breast cancer. Other risk factors include radiation to the breast tissue at a younger age, denser breast tissue, or prior biopsies that have shown benign but high-risk lesions. And there's also things we take into account like your cumulative lifetime estrogen exposure. So the higher the estrogen exposure, the increased your risk. So starting your menstrual cycle earlier, going through menopause later, never being pregnant, never having kids, never breastfeeding, those can all increase your risk.
Wow, a lot of those I didn't know about. So very important to be aware of those. Now, what are the advantages of high-risk screening and early detection of breast cancer?
So high-risk screening, those patients that fall into that 20% lifetime risk, the benefits we not only talk about now yearly mammograms, but you augment the yearly mammograms with MRIs as well. So you're alternating imaging every 6 months. And the biggest benefit, I think, is and what people don't know is that they don't just start at 40. They start 10 years prior to the youngest family member diagnosed. So you may start screening in your 20s or 30s, which is not something that is generally known.
Right.
But the benefits of starting screening early is early detection. So finding cancer before you develop signs or symptoms when treatments can be more successful and curative.
Okay, and speaking of those signs and symptoms, what are the signs and symptoms that younger women should be aware of, and do men also need to pay attention to anything?
Definitely, especially men who have a strong family history, breast cancer, prostate cancer, they should be paying attention. In women specifically, we used to say, you know, do monthly breast exams in the shower, but now it's more so focused on breast awareness. So being familiar with your shape, texture of the breast tissue, doing evaluations, sitting up, laying down in different positions, and in the mirror, you're specifically looking for like contour changes, shape changes, skin changes like dimpling, redness, flakiness of the skin, nipple discharge, or any new lumps or bumps you may feel.
Okay, great information. Thank you for this. And finally, where can people go for more information on Memorial Healthcare?
They can call the number on your screen or visit memorialhealthcare.org.
All right, thanks so much for being here and sharing this very important information. We appreciate you.
Thank you.